I have suffered from a torn ACL, just like Tom Brady, a professional NFL quarterback, Michael Owens, a world soccer player, and Skylar Diggins, a female basketball player. I am going to talk about the information from an ACL tear. What is an ACL tear? An ACL is short for an anterior cruciate ligament. The ACL is a ligament located in your knee that controls rotation and forward movement in the shin bone. The most important ligament in your knee is the ACL because it is the center point. The knee has 4 main ligaments in it: the ACL, which is in the center, the PCL, the MCL, and the LCL, which all connect in the knee. How does an ACL tear? According to Hopkins medicine, the anterior cruciate ligament, which is the ACL, is one of the most common ligaments to be injured. The ACL is often stretched or torn during a sudden twisting motion when the feet stay planted one way but the knees turn the other way. You most likely tear your ACL doing a sports activity like I did. I tore my ACL during a basketball game last Valentine's Day. Like it said before, my body went one way and my knee went the other. I felt a pop afterwards, and a month later I got an MRI, surgery in March 17th. From then, I have done PT, which is physical therapy, for the past 11 months. I just kept on reading on what Sean Johnson says. Injury taught me I need to learn how to face challenges. How do you diagnose an ACL injury? According to Mayo Clinic, X-rays and MRI is mainly what you need. The X-ray is how to figure out if you have a bone fracture or not. The MRI shows a full image of the knee to show the ACL and other ligaments and signs of damage to other tissues in the knee. The treatment after ACL injury can lead up to having surgery because doctors highly recommend having surgery after you tear your ACL. They also recommend, after you figure out you tore your ACL, is rest, ice, compression, and elevate. Those are very important. During surgery, according to Mayo Clinic, the torn ligament is removed and replaced with a piece of tendon from another part of your knee and from a decreased donor. The surgery is an outpatient procedure that's performed through small incisions around your knee joint. They normally have a scar straight down the middle of your knee, which is what I have. During my surgery, my surgeon put a titanium screws to anchor the tendon, which is what some doctors highly recommend for athletes that are coming back from an ACL injury. Right after surgery, you start physical therapy. A normal ACL tear is 6 to 9 months, but I also tore my lateral meniscus, so I'm 9 to 12 months process. In conclusion, an ACL tear will have a negative effect on a player's career and mindset. The knowledge of knowing there's a chance of re-injuring is terrible for an athlete like me. So from experience, the main part that I think athletes should focus on is rehab, focus on PT, and not being afraid when returning. Ashley Algredo says, no athletes truly tested until they've started an injury in the face and come out the other side stronger than ever.